Assalamualaikum, salam sejahtera and good day. Today we are going to learn about the thigh muscle. The thigh muscles. The thigh muscles are actually the muscles that move the knee joint. Move the knee joint. Okay. The objective of today is to identify the origin, the insertion and function of thigh muscles. Now, the thigh muscles are grouped into three groups: anterior compartment, medial compartment, and posterior compartment. Okay, I repeat, anterior compartment, the main function is to extend the knee. Medial compartment, the main function is to um, helps in extension and also adduction of hip joint. And then we have the posterior compartment, which is the main function to flex the knee. Okay. Now, let's take a look at the anterior compartment of thigh muscles. Okay, anterior compartment of thigh muscles. What are the muscles that we can find in the anterior compartment of thigh muscles? There are three muscles. Basically, the two muscles from these three muscles we have already discovered during the session in pelvic girdle muscles. They are the psoas major and iliacus muscle, which eventually form the iliopsoas muscle after it passes through the inguinal ligament. Okay, so that one we skip. The two muscles, psoas major and iliacus or iliopsoas muscle, we skip because we have already covered that in pelvic girdle muscles. So we are going to concentrate on the quadriceps femoris muscle. Quadriceps femoris muscle. Okay, what is quadriceps femoris muscle? Quadriceps femoris muscles is actually a group of four muscles combined together and they produce one similar movement. Okay, these four muscles are known as, from superficial to deep, the rectus femoris muscle, rectus femoris muscle, vastus lateralis muscle, vastus medialis muscle, and vastus intermedialis muscle. Okay, vastus vastus intermedialis muscle we cannot see from the anterior view of the thigh because it is actually embedded beneath the rectus femoris muscle. Okay, so these four muscles form the quadriceps femoris muscle. These four muscles form the quadriceps femoris muscle. From the four muscles, the rectus femoris arises from the ASIS and also the just above the acetabulum of the uh, acetabulum of the ilium, okay, of the pelvic bone. Okay, the rest of the three other muscles of quadriceps femoris arises from the greater trochanter of the femur. Okay, they are all merged together, and the fibers then inserts into the tibial tuberosity of tibia. Tibial tuberosity of tibia. The tendon is so thick that it runs through the patella or the kneecap. Okay, it runs through the tendon of quadriceps femoris is so thick that it runs through the patella or the kneecap and inserts itself finally at the tibial tuberosity. The function is to extend the knee, extend the knee extension. Okay, now let's take a look at the medial compartment of the thigh. Now, medial compartment of the thigh has a little bit more muscles than the anterior compartment. Right. What are the muscles? The muscles are from medial to lateral, the gracilis muscles here, the very thin and elongated muscles here, arising from the inferior pubic ramus, and inserts itself at um, uh, the medial side of the tibial tuberosity. Okay, medial side of the tibial tuberosity. Right. Then we have the pectineus muscle, and then we have the adductors. There are three adductors: adductor brevis, adductor longus, and adductor magnus. Okay, adductor brevis, longus, and magnus. There are three adductors. Okay, the pectineus muscle and the adductors are all arises from the or originate from the pubic ramus, either superior or inferior pubic ramus, and they insert themselves at the linea aspera of the femur. If you still remember the bone markings of femur, linea aspera can be seen, can be demonstrated at the posterior part shaft of femur, right? Right, and the adductors are arranged in such a way from superficial to deep is adductor longus, adductor brevis, and then only you can see the adductor magnus. Adductor magnus is such a huge muscle, right? The pectineus originates from the superior pubic ramus and inserts itself at the pectineal line. Pectineal line also is seen at the posterior part of the shaft of femur, right? And then last is the obturator externus muscle. Obturator externus muscle, which you cannot see here, but I'll show you later. It arises from the obturator foramen of the pelvic bone, and it inserts itself at the intertrochanteric crest of the femur, also at the posterior part. And all of these muscles, they are actually the adductors of hip joint. Adductors of hip joint. It also helps in knee flexion. Knee flexion. They are the adductors of hip joint, but they also help in knee flexion. Okay. All right. Let's see the cross section of this diagram, which can show you clearly the location of adductor magnus. Okay. This is adductor magnus. Okay. Adductor magnus is beneath adductor brevis and adductor longus. Okay. This one here, this muscle here that you see just inferior to the superior pubic ramus, underneath or behind the hip joint, the capsule of hip joint is the obturator externus muscle. Obturator externus muscle. Okay. All right. The posterior compartment of the muscle of the thigh composes of hamstring muscle. Hamstring muscle. Hamstring muscle is a group of muscle that is composed of three other muscles. Okay. Hamstring ni satu kumpulan otot. Dalam kumpulan otot hamstring ni ada tiga muscles. Apa dia? Semitendinosus. Okay, on the medial side, posterior view, posterior part. Underneath semitendinosus is semimembranosus, also at the medial side. And then we have the biceps femoris. Biceps femoris. As the name implies, biceps has two heads. Okay, so the long head arises from the ischial tuberosity, similar with semitendinosus, which arises from the ischial tuberosity. Okay, and then the short head of biceps femoris arises from the shaft of femur posterior side. Okay, these muscles, they are the knee flexors muscle. Okay, knee flexor muscles. The semitendinosus will insert itself at the medial border of the tibia, while the long head of biceps and short head of biceps will eventually insert themselves at the head of fibula on the lateral side. Okay, and the semitendinosus will inserts also at the medial border of the tibia or at the medial epicondyle. Okay, at the medial epicondyle. So the main function is to flex the knee. flex the knee. So in summary, the thigh muscle has three groups, three compartments: anterior compartment, medial compartment, and posterior compartment. And in a general rule, anterior compartment flex the hip but extend the knee. Posterior compartment will flex the knee. Medial compartment will ADD or adduct the hip joint. It also helps in the knee flexion. Okay, the muscles in the anterior compartments, there are three. The iliopsoas muscle comprises of psoas major and iliacus, and also the quadriceps femoris muscle, which is located at the anterior thigh compartment. And quadriceps femoris has four muscles: rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. All of these inserts at the tibial tuberosity of the tibia. Okay, the medial compartment comprises of many muscles. Specifically, there are three adductors: adductor brevis, longus magnus, the gracilis, the pectineus, and obturator externus. The main function is to adduct the hip joint as well as to help or agonist in knee flexion. All right, then the posterior compartment of the thigh muscle composes of the hamstring muscle. The hamstring is a group of three muscles, which is semitendinosus, semimembranosus on the medial side, and the biceps femoris on the lateral sides. Okay, and these three muscles' primary function is to flex the knee. Until then, I'll see you again. Thank you.